Every year, nearly 3 million people die of undernutrition, and you've got 2.5 million people dying from wash-related diseases connected to water, to sanitation, to hygiene. When you look at these two populations, they overlap, it's the same population. I give you a very simple example. A person suffering from undernutrition is a person who is going to degrade its immunity. And the person who loses immunity is going to be very sensible to infections and is going to fall in infections like diarrhea, etc. On the other hand, someone suffering diarrhea is going to develop catabolism. It means that the aliments are not going to nourish him. They are going to flow with the excreta, and the person is going to be undernourished. So this is the vicious cycle we need to cut. And to cut that, you need to implement toilets, to provide safe water access, and to develop hygiene practices on the long term.
I think there is first a cultural barrier. People will agree on doing a water program because it's about cleanliness and it's nice. Sanitation, it's about dirt, it's about shit, and so people have much more difficulties to speak about it, to get involved in it. And also it's about behavior change, and this is one of the most difficult things to do in a development program, which is to support people in changing their behaviors, and it's all about it, in fact.
Almost every nutrition budget has in it WASH actions. So more the question is the degree to which they have a lot of WASH actions or not a lot. One of the things that we heard during the development days was about a piece of research that's just been conducted by WaterAid and SHARE that looked actually at to what extent WASH is present in nutrition policies and nutrition is present in WASH policies. And a good example that emerged from that was the country of Nepal. And in Nepal, it seems that the nutrition policy figures WASH prominently. It can be found throughout the nutrition policy in different ways. In terms of the presence of WASH in nutrition budgets, that's actually the next phase of the research.
The European Union, a lot of NGOs, the UN are working on that. They developed a strategy called the WASH in Nutrition strategy, who is tackling this at different levels, at the global level, UN level, for example, WHO, etc., at the national level, because the politics, the institutions of the countries need to decide on their national strategy where to go with that, and at the practical level for the operators who need to build their programs integrating the two sectors. What we are saying is that today, if we want to eradicate undernutrition, we cannot do it without providing a proper water and sanitation, sanitary environment.
I think let's speak about shit, about sanitation, the impact it has on health. I think it's really important that it's coming out and people speak more about it.